We're following up tonight on the situation at the U.S. Department of Veterans Affairs. It's about 9 months since those secret waiting lists were exposed. The VA admits as many as 40 veterans died waiting for care. Since then, Congress passed a major overhaul of the agency. Now, some of those changes being felt right here in the tri-state. There is still a wait, though. The VA facilities in Evansville and Owensboro report 46 veterans are currently waiting more than 90 days to see a doctor. Tonight, I investigate, is there an about-face at the VA? They sacrifice, exhibit patience. But after 3 months of waiting, Rick Gaskell's patience wearing thin.
That choice program where it's supposed to help veterans, that's just been a hindrance to me. They don't give you the right information.
The Vietnam veteran suffers many seizures. He can't drive until a neurologist prescribes medication.
You don't feel it coming on, you have no warning, but it's like you're in a trance for just a few seconds.
Gaskell hoped the Choice Care program will get him in to see a doctor sooner. It's one of several initiatives included in a law Congress passed last year that overhauls the U.S. Department of Veterans Affairs. It connects vets with participating private physicians if there's not a VA facility within 40 miles or a VA doctor can't see them within 30 days. But the neurologist assigned to Gaskell, 70 miles from his home in Hartford, Kentucky, in Elizabethtown.
That's ridiculous.
Gaskell says under Choice Care, his VA benefits aren't accepted because he has Medicare, meaning more out-of-pocket costs. The former Marine's frustrations only continue to grow.
They called me, they said, oh, we have an appointment in 2 days in Owensboro. I said, well, great. And they gave me the name of the doctor, and I didn't recognize it. And I called him. He's not a neurologist. He's a psychiatrist. The people aren't doing their jobs. You know, the federal's still pretty frustrating.
The $16 billion VA overhaul also funds hiring thousands of doctors and healthcare workers. Evansville's VA facility added 13 positions, including a physician and 5 nurses. One part-time physician started in Owensboro, and at the region's headquarters in Marion, Illinois, 40 positions were created, including 2 physicians and a handful of mental health professionals.
When you schedule your appointments, you know, it's not taking 4 months to get in there and get your appointment anymore. You're getting your appointments fairly quickly now.
What's fairly quickly?
Maybe 2-3 weeks at the most.
Army veteran Paul Glover did 3 tours in Kuwait. He says his body took a beating working the M1A1 tanker truck and has needed a series of surgeries. Between that and leading VFW Post 1114, he's familiar with the VA services.
They're doing the best they can, and they're working on making it more receptive to the veteran to get the veterans in there as quickly as they can.
But veterans are still waiting. Since those excessive waiting lists were first exposed, the VA reports the average wait, 27 days to see a doctor in Evansville. It's 15 in Owensboro.
The average in of itself, probably a bit misleading. Those numbers can change based on clinical need, medical judgment. Sometimes it can be affected by patient choice of when they get seen and all of that. So the number in of itself is a great indicator to point to, yes, let's look into this, but the number in of itself doesn't necessarily mean a bad thing.
Marion VA Medical Center Director Donald Hudson says established patients could be seen in a matter of days. New ones take longer. He says the creation of a master scheduler position will help streamline the process of making appointments.
If you have multiple people from their perspective telling a person, well, this is a priority, this is a priority, this is a priority. Well, when you have so many priorities, what becomes the priority? And so there was tremendous gains to be had in reducing the variability just by funneling things through one person.
That overhaul law also calls for VA employees to be held more accountable. Over the last year, the VA reports taking disciplinary action against 5,600 employees for providing poor care. So what about locally?
I have not found any instances of any of our staff doing any type of malicious behavior. I believe that they are working very hard on behalf of the veterans, And I found that our people are interacting with the veterans in a very respectful, compassionate manner.
Director Hudson says he regularly visits the clinics he oversees, especially to check up on expanding services. In Evansville, the VA Healthcare Center recently started offering same-day surgeries and endoscopies. It opened an infusion center to help arthritis sufferers and will soon start administering chemotherapy, a treatment that previously required veterans to travel to Marion.
The military is just something you do.
While this certainly will be more convenient for some veterans, others like Rick Gaskill still find themselves waiting for care. With that growing need for specialists, the VA is also hiring physicians from the private sector and giving them part-time hours. Of the 36 physicians in Evansville, 20 of them are part-time, which might explain why it's harder to get in with a doctor, because they're not working full-time hours.
That's right. And you talked to some veterans that we did not see in this report. Why is that?
That's right. I've had several veterans reach out to me saying that they wanted to speak with me, but then they would back out of fear of retaliation because they need those benefits through the VA, and they worried that if they talked poorly on the VA, that they would not be able to see a doctor.
Well, this is a story that will probably continue to evolve over time.
Probably for years to come.
All right. Thanks.